All right, so what are prodrugs, why do we make them, and what are some examples, part 2. So remember, a prodrug is a medication or a drug that's inactive, and then it's biologically activated to the active form. Another reason why we make prodrugs is to increase oral bioavailability. An example would be cefpodoxime peroxetil. This medication is a third-generation cephalosporin. It's usually used for something like upper respiratory infections. To do this, we add polarity to the group, so we have this long little polar group with all these little oxygens on there. It's absorbed, it's cleaved by esterases, and then undergoes spontaneous collapse into the active form cefpodoxime. Another reason why we make prodrugs is for a sustained release system, sustained delivery. So by adding a bunch of lipophilic groups on a drug, for example, fluphenazine, we increase the duration of action. So this drug is given intramuscularly in the muscle, and then it forms a little depot, so it has a sustained release. So fluphenazine is a typical antipsychotic, aka a first-generation antipsychotic, and it's given IM or sub-Q every 2 weeks about, and it lasts up to maybe 4 weeks sometimes in patients. Another example of another prodrug would be gabapentin and carbol. That's what the structure is. So this is Horizont, is the brand name. It's for restless legs and post-parhetic neuralgia. This medication was formulated to have better bioavailability and then also have an extended release system. So it's metabolized into gabapentin down here, and then some byproducts. It's usually administered in the afternoon around 5 p.m. Another example of a prodrug is Vyvanse or lisdexamfetamine. This structure metabolizes into L-lysine, which is an amino acid, and then D-amphetamine is the active form. So it's cleaved by enzymes in red blood cells. So the thought with this is that it has better tolerability in that it has a smoother onset and then offset. So you don't get those peaks and crashes that you do with immediate release Adderall, for example. So by formulating it as a prodrug, we get a longer duration of action, and then we also get a lower abuse potential. Because say if you snort it or inject it, you're not going to get that high, that rapid high, because it's not active in the active form. It's a rate-limited process, so it has to metabolize into the active form. But with Adderall and stuff, you can snort it and it has an immediate effect right away. Another example of another prodrug is Plavix or clopidogrel. This is an antiplatelet. We give patients usually after they get a stent with a myocardial infarction or heart attack, and then we give it to them after strokes and stuff. So it's not active in the active form, and then it's enzymatically activated in the liver to the active form. The main enzyme that does this is CYP2C19. It's important to know that Prilosec or omeprazole, over-the-counter for heartburn or acid reflux or GERD, is an inhibitor of this, so it inhibits the activation of this. So I would not recommend the co-administration of these medications in someone, say, who just had a heart attack and is just recently stented. Another example is tamoxifen, which is a selective estrogen receptor modulator that we use for chemoprophylaxis in patients who are high risk for breast cancer, and then we also use it as endocrine therapy in breast cancer patients. CYP2D6 is an important enzyme for its activation into its active metabolites. So some examples of 2D6 inhibitors would be Prozac and Paxil. A couple more examples of prodrugs are heroin. It's metabolized into 6-MAM or 6-monoacetyl morphine and then morphine. So we can tell if someone's used heroin because we check for 6-MAM in the urine. And then we have codeine being metabolized into morphine via 2D6 and then inactivated via 3A4. So it's not recommended to give children codeine because we don't know if they're going to be ultra-rapid metabolizers and ultra-rapidly metabolize it into morphine. Another prodrug is psilocybin, which is in shrimps, and it's dephosphorylated into psilocin, which is the active metabolite, and then that's a serotonin agonist, meaning it acts like serotonin on the receptors. Another example of a prodrug is L-dopa or levodopa. This is in the drug Sinemet, which is carbidopa-levodopa. It's gold standard for Parkinson's disease. So in Parkinson's, patients have nerve cell damage in the brain that causes dopamine levels to drastically drop. So what we do is we give L-dopa, which metabolizes into dopamine, to sort of replace that. But the problem with this is that dopamine does not cross the blood-brain barrier, which is where we need that dopamine to be. So a way around this was L-dopa, so it crosses into the blood-brain barrier and then it metabolizes into dopamine. So we formulate it with carbidopa, which is a peripherally acting aromatic L-amino acid decarboxylase inhibitor. So it stops the metabolism of L-dopa in the periphery and allows it to get into the brain where it needs to be its site of action. And one last example is acyclovir. It's used for herpes like genital or cold sores. It's also used for shingles. Intracellularly, it's converted by viral thymidine kinase into this little acyclovir monophosphate, and then eventually to the acyclovir triphosphate, which is the active form. So this active form inhibits viral DNA polymerase and DNA replication. I will mention that valacyclovir or Valtrex has an L-valine group on it that increases absorption.